Welcome to Project First Line. Thank you for joining us. Today we're going to talk about body reservoirs, places on and in the human body where germs live. We'll also talk about why understanding these reservoirs is important for infection control and healthcare, and how your knowledge can help you recognize infection risks so you can take action and help keep germs from spreading. Throughout this training and in all other Project First Line infection control training modules, the term germ refers to bacteria, fungi, or viruses that are likely to pose challenges to infection prevention and control. Take a moment to think about the parts of the body or body system that you think are most likely to pose risks for germs to spread in healthcare. When we think about how to keep germs from spreading in healthcare, it's helpful to think about germs in the context of where they usually live, or their reservoirs. Knowing where germs live can help you recognize where there is risk for them to spread. It also helps you understand why infection control actions work to stop germs from spreading and making people sick. In this session, we'll focus on 4 reservoirs of the human body that are important for infection control. There are other examples of body systems where germs live, but we will focus on skin, the gastrointestinal system, also known as the gut, the respiratory system, and blood. Turn to page 2 of your participant booklet and review the table for the skin reservoir. After reviewing the table, what do you think is the most important thing about the skin reservoir to prevent the spread of infections, and why? Many germs, especially bacteria, grow on the skin and help keep it healthy. Some of those germs can be harmful to vulnerable patients. Common groups of bacteria on skin include staph, including MRSA and Streptococcus. Candida, a type of yeast, is also commonly found on the skin. There are a lot of important things to remember about skin for infection control. Germs can easily spread from the skin, primarily through our hands as we use them frequently. Touch serves as a major pathway for the transfer of germs to and from the skin. Germs present on your skin can be transmitted to people and surfaces. Your skin can pick up germs through contact and then pass them on to others or contaminate surrounding surfaces. We also do things in healthcare that break patients' skin, such as inserting an IV or performing surgical procedures. When that happens, germs on the skin surface can be introduced into the patient's body or bloodstream. Some infection control actions that can help stop the spread of germs from skin include cleaning hands and practicing good hygiene, using personal protective equipment such as gloves and gowns, routinely cleaning and disinfecting surfaces and devices, performing safe injections, and handling sharps safely. Now let's talk about the gastrointestinal system, or GI system for short. To become more familiar with the GI system, refer to page 3 of your participant booklet. The GI system consists of 2 tracts, the upper GI tract and lower GI tract. The lower GI tract, commonly called the gut, usually refers to most of the small intestines, rectum, and anus. Most of the GI terms that cause infection control problems come from the gut. The upper GI tract includes the mouth, esophagus, stomach, and first part of the small intestine. It has different types of bacteria and fungi that we usually think about separately from the lower GI tract. The intestines are filled with bacteria and some yeast that are an important part of a healthy immune system. Common germs found in the gut include E. coli, Klebsiella, C. diff, and Candida. Because these germs live in the intestines, they are present in our stool. Germs from the gut travel easily in stool, and they're often found in the environment, like on surfaces in bathrooms. Touch is a major pathway of spread for these germs because they spread so easily. Bypassing or breaking down the body's defenses is another way that they can be spread, such as through GI procedures. It can also happen if these germs are on the skin and are introduced into the body through a procedure, such as an IV insertion. Infection control actions that can help stop the spread of germs in the GI system include cleaning hands using PPE like gloves and gowns, cleaning and disinfecting surfaces and devices, handling linens and textiles carefully, and managing trash and waste appropriately. Follow the content on page 4 of the participant booklet as we explore the next reservoir, which is the respiratory system. The respiratory system comprises two primary components, the upper airway, which includes the nose, mouth, throat, and windpipe, and the lower airway, housing the lungs. Germs in the nose and mouth can easily be spread to the skin and hands when you touch your face, and from there, they can spread to surfaces and other people. The defenses of the nose, mouth, and throat play a crucial role in preventing many germs from reaching the lungs. However, when germs surpass these defenses and infiltrate the lungs, they can lead to infections and spread to others through respiratory droplets generated by the infected person during activities like talking, breathing, sneezing, or coughing. Certain germs in the upper airway, particularly viruses, can also be transmitted in this manner. Germs commonly found in the respiratory system include Pseudomonas, staph, including MRSA, and when someone is infected, respiratory viruses. Implementing measures for infection control that can effectively halt the transmission of germs from the respiratory system involves actions such as cleaning your hands, coughing into your elbow, and appropriately disposing of tissues. Adhering to respiratory hygiene practices, observing cough etiquette, and wearing a mask that covers both the nose and mouth are essential in preventing the spread of respiratory droplets. Additional infection control measures include ensuring adequate ventilation, practicing physical distancing in shared spaces, using PPE like respirators and gowns correctly, and conducting thorough cleaning and disinfection. Take a moment to review page 5 of your participant booklet for key principles related to the final reservoir, blood. Blood is an important reservoir to think about for infection control and healthcare. It's not supposed to have any germs at all, but there are blood-borne viruses that can spread, especially by needle stick. Also, if a needle or syringe is reused on more than one patient, or a vial of medication is contaminated with blood, germs from one person's blood could be spread to someone else. Blood is nutritious food for bacteria. If blood gets on germs in the environment, like on linens or a device, those germs are likely to grow and multiply and can spread. It's also important to think about splashes and sprays, like in procedures such as blood draws, when blood can splash or spray into the eyes and mouth. Touch is important too. If blood is on surfaces or linens, germs can spread from that blood. Infection control actions that can help stop the spread of germs from blood include performing safe injections and handling sharps safely, using PPE like gloves, gowns, and eye protection, cleaning hands, handling linens and textiles carefully, and routinely cleaning and disinfecting surfaces and devices. We've covered a great deal of information today, so let's take a moment to revisit some key points from today's training. Reservoirs are the places on and in our bodies and in the environment where germs live. Germs frequently spread between and among reservoirs. 4 reservoirs in the human body that are important for infection control are the skin, GI system, respiratory system, and blood. There are other examples of body systems where germs live, but these 4 are particular focus areas for infection control. Understanding where germs live allows us to recognize where there is risk for them to be spread and helps us understand why infection control actions work to stop them from spreading and making people sick. Thank you for your time and attention today. I hope that you can use these ideas in your work to help stop the spread of germs. Even though we covered a lot today, there is still much more to learn. You can keep exploring these topics on your own using the resources in this module. Project First Line has a suite of products to help you learn how to recognize infection control risks at work and to help you learn more about where germs live in healthcare and how they spread.